So we're going to go over that little stretch for those deep rotator muscles, kind of into those pelvic floor muscles that we've worked on in sessions. I may have called it the Sissy stretch or the I gotta pee stretch, the airplane stretch, any of those types of names. But we're going to try to go over that. It is kind of difficult for me to teach to patients, and sometimes they don't need it, so they won't feel it in the correct spots, or it will hurt them, like not hurt them, but it won't feel good to them. So it should feel good to you, and it should feel like there is a good deep stretch through here, maybe into the pelvic floor just a little bit. So we're going to try that one now. You're going to have a surface that's about hip-ish level, maybe like your countertop of your bathroom or your kitchen. And you're going to walk back. You can be on elbows if you'd like. We're going to keep the stretching side straight but not locked out. And we're not going to sit into that hip like this just yet. We're going to keep it nice and straight. And then our other foot is going to be toes at heel level. And heel is lifted up on that side. They're going to be close together. And you're going to take this at the bent knee around the straight leg. And you're going to keep this leg straight. And then you're going to sit back with that hip. And you're going to play with this stretch a little bit. Is it better going straight back? Or can I kind of rotate into it a bit more and sit my hip back opposite of that side? So like if I'm doing my right side, can I sit it back to that left side and feel that stretch real deep? And then you're going to hold that for 20 or 30 seconds, whatever feels good. It feels like it's releasing some of those muscles, and focusing on your breathing here. So and then coming back out of it, you're just going to undo the steps that you did, and then we'll switch sides. Toe is about where that heel is. Heel on that side is lifted up. Knee is not locked out, it's just mostly straight. We're going to rotate. So you might think I am literally rotating my pelvis around that straight leg, that femur. And see, so I can find that stretch even standing and then sitting back. So you can see, I gotta pee. Or Sissy stretch, right? Okay, and then holding that just however long feels good, but try 20 or 30 seconds. And that should help release some of those deep rotators and pelvic floor muscles for you. Use this stretch for as long as it serves you. Once it stops feeling good, or once you feel like, you know, I'm just not feeling a stretch anymore with this, you don't have to continue doing it. But I'll find myself doing it when I feel like my pelvic floor is overactive, or I've been clenching those deep rotators too much, and I'll do that. But only when I really need to, okay? So if you have any questions, make sure to ask in your next session, and we'll go over this again.